Hello Ryan, my name is Hunter, and today we will be doing the Ensure method to insert surfactant into this baby. My assistants today are Belinda, Eli, Scott, and Kaylee. Alright, thank you, enjoy. Alright, so to start, we have a child. We will verify the order and the patient weight. This particular baby weighs 1,700 grams and is 32 weeks, and we will have to make sure that this baby is hemodynamically stable and that there are no contraindications. This baby has no contraindications, so we will move on. We will be inserting InfoSurf at 3 milliliters per kg and for a dose of approximately 5.2 milliliters. The supplies we will need to gather are intubation supplies. We have these here. The multi-access catheter, which we also have. The T-piece, thermal regulation, suction, and monitors for SpO2 and EEG. And we will also warm the surfactant to room temperature. All right, now we will begin our Ensure method once we have gathered all of our supplies. So we will intubate with my beautiful assistant Scott on my right. Thank you, good sir. Okay. Thank you. Now we will verify the ET2 placement with bilateral breath sounds as well as an X-ray, and they have done that. Now we will begin ventilation. And Scott will be doing my breaths at 1-2 breathe rate, and we can just simulate you doing that. You'll have to do that. Okay. Okay. Now we will also begin to suction. Thank you, assistant. Then we will attach our multi-access catheter. While still manually ventilating with the T-piece. Then we will position the infant for administration, first going to the baby's right. We'll do that. And we will insert the cath to the same level as the ET tube. And we will administer the surfactant over 1 minute and monitor the baby's tolerance while we're doing so.
I don't think you have to actually do it over again.
Okay. After it is administered, withdraw the catheter, return the baby back to normal. And then once we are back to the normal, we will recheck the ET tube. It is there, has not moved. And manual ventilate for 1 minute while monitoring pressures and tolerance. If necessary, we can increase PEEP, avoid increasing the PIP, and to increase MAP, we can increase the respiratory rate or the TI, and the TI. And then we will repeat those steps. So we will move the baby this way now. And we will insert the catheter the same level as the ET tube. And then administer the surfactant over 1 minute. And we'll do that. Move the catheter, return the baby back to place, and then recheck the ET tube, make sure it hasn't moved, and it has not. And then we will do the same thing, manual ventilate for 1 minute while monitoring pressures and tolerance, and if necessary, increase the PEEP, avoid increasing the PIP, and to increase the MAP if we need to, increase the respiratory rate and the TI. Now the baby is stable, so now we can return to the previous respiratory support and back on the ventilator if the baby is intubated, and then extubate. Once that is done, monitor and adjust FiO2. Avoid suctioning for at least an hour to make sure the surfactant has optimal administration, and then repeat the dose after at least 12 hours if indicated.